Hi guys, and welcome to episode 37 of Notable Needlework. I am Kate Notable Needle, Noteable, on Ravelry, on Plurk, and on Twitter. The blog, if you're watching this on iTunes, is at notableneedlework.blogspot.com. There is a Ravelry group, and you should feel free to join it and partake in the fun. This may be a longer episode. I am warning you up front because there's a whole bunch of stuff to talk about. Whole bunch. I will start right in with the knitting. I have a finished object. It's a small miracle. This is the Twisty Goo hat, which is designed by Lisa Beamer, also known as Fiber Nymph of Fiber Nymph Dye Works and 90% Knitting. And I swear that's the only reason I know who the designer is, like the name. I never remember the names of designers, and I feel bad about that. I love the hat, and I've been wearing it pretty much constantly because it's actually cold enough to do it now. It is out of the Madeline Tosh Vintage in the Jade colorway, which my husband was quick to mention that Jade doesn't look like this. I don't care. It's pretty. I was wearing it yesterday to our homecoming parade. If this is your first time watching, I am at the University of Alabama at Birmingham, and we are the Blazers, and it is our homecoming day today. Which is probably why I've been wearing so much green recently. But, I finished it, and I didn't have to wear my uniform to school yesterday, so I wore it with my green Blazers sweatshirt and was representing Blazer Pride. Although, yeah, I'm not going to the game because I suck like that, but I'm also sharing my Alabama Pride. It's Alabama versus LSU today, so go Bama, roll Tide, etc. I'll find out what the score of the game was later. but yeah, this is of course my hat. Love it. Seriously, the yarn is super soft. It's not sock yarn soft, but it's not scratchy at all. I think, what is it? It's 100% superwash merino. And fortunately, after finishing the hat, I weighed, if I can figure out where I just put it, I weighed the yarn that I had left, and I actually had more than half of the skein left, and if I didn't bring it in, I'm just going to start laughing at myself, because, there's a lot of stuff on my desk right now. But I had more than half of my skein left, which wound up being, I think, a little over 100 yards. So I was perusing around on Ravelry, and I found I think they're called the Manly Mitts. I don't know why they're called the Manly Mitts, because it has like this cute diamond pattern. It's pretty much all knit in stockinette, but there's a pearl diamond pattern that sort of shows up, and with a tonal yarn like this, it makes it show up a lot more. So I cast those on last night. I got so much done. I know, I've been working on everything, so it doesn't ever look like there's a whole lot of progress on anything that I've done. Other works in progress, I am working on the socks for Christian's grandma. This is the first pair of the socks. I just put in, if I can find it, the marker for the Afterthought heel. Like literally, this is the row just past it, because you can sort of see that there's a blue stripe that doesn't belong. And that's the yarn for the Afterthought heel. I was working on them during breaks in clinical and figuring out how long to make them. And we had a review session on Friday, and Christian was actually there, so I could ask how long She wanted them whether her grandma wears them with the cuff over or not, which she doesn't, so I didn't have to knit them as long as if she liked long socks with the cuff. But we agreed on here, and it'll be in the middle of this 3-stripe section. So it'll be right in the middle of the light purple stripe, and it'll split and do the heel. I think it'll be super cute. So I'm calling these like 40% done because I just have to finish through the foot. I looked up the measurements for a size 8 for how long the foot has to be. I know I leave off like 2 inches, like 1.5 inches to 2 inches shorter than the whole foot's supposed to be because of the afterthought heel. Do the toes and then put in the afterthought heel, and I can do those 2 at a time. So my hope would be to have these done by the end of next week. I'm not sure how well that's going to happen. Well, no, because after Tuesday I've got more time to do it. So maybe these will get done by next weekend. We'll see. I'll talk about my crazy week after I'm done with the knitting. I have so many works in progress because I want to feel like I'm actually getting something done as far as Christmas knitting goes. I have a giant list, of objects on, we now have 2 whiteboards in the hall. I've got a little one where I have all of the projects that I have to do, and then the big one, which is all the stuff that both of us have to like do for the coming week. Mine is for the next 2 weeks, because after I'm done with the next 2 weeks, I'm pretty much done. And stuff to remember and the little stuff, which is on this huge board that I got for $10 at Staples. But I made a list of the Christmas and otherwise related objects. I think there's like 15 things on the board, and I have like 2 of them done. It's gonna be fun. I'm setting my priorities and going from there. So like, obviously this is going to be my mom's Christmas project, so this kind of has to get done, because if I make knit things for other people and not my mom, I'm gonna feel like a jerk. Plus it's an easy enough shawl. I just really haven't worked on it this week. I worked on it at the Christmas party I went to, and I haven't really worked on it since then. But this is the I Heart Lace shawl, and it is my Volmisa that I won for the Plurk Podcaster Challenge Super Knitter. It's a dark teal color. I think I decided that it was originally the Neptune Dark, but it is a weird different colorway, and you can sort of see the darker spots in it, which is why it's a word different, because something went wrong in the dyeing process. But I like it, and it has the individuality to it that I know my mom will appreciate. And it's the Volmisa 100% super wash. It's not the 80/20. So that's getting there. I know that I have to finish the shawl before we leave for California, because I'm not bringing my blocking wires with me to California. That's not happening. So this has to be done before that. But the 2 pairs of socks have to get done before I'm done with school. Because I guess technically I could mail them from California if I finish them then, but I really want them to be done before I leave, because then Christian can pay me before we leave and I can buy stuff when we're in California. Plus, I just want to have it done, because when it's an order, I want to have it done, and I don't want to risk not finishing it in time and then looking like a jerk. The only other work in progress that's like actively in progress is my faux Noro scarf. This is the Noro striped scarf pattern from Jared Flood, and I am not doing it in Noro. I am doing it in Lion Brand Amazing in the Aurora and I want to say Glacier Bay, but that might not be right, colorways. And it's stripe of one colorway, stripe of another, and as the color changes, the stripe colors will change. And now that I have shown that, that's actually a nice segue into stash enhancement, because that's where I got those. I did not have those in my stash last week. How to go about this one. So I have two different sets of stash enhancement. One is the yarn that I bought, which will be second, and the first is yarn that one of my friends gave me. Her mother is an avid knitter who also has kleptomania. Yeah, it's really not funny. My friend's reaction to it is funny, but the entire situation is not funny. Her house is literally filled with stuff that she will never use, especially yarn. So, one of our friends, it's her mother, who has all the yarn, gave me my choice of yarn from the house because she knows that I will actually use it. It will not just sit around. I keep telling myself that. No, really, there's so much yarn in there. There's more than probably my local Joann's has, plus my other local yarn shops combined. But yeah, I came out with quite a bit of yarn. The Lion Brand Amazing was among them. I have 2 balls, skeins, whatever, each of these 2 colors in the same dye lots. For this one, I want to see how far I can get with 1 ball each, because I'd like to make 2 of the scarves, because I kind of want one for myself. This one's going to be for my sister-in-law, most likely, for Christmas, because 1, she lives in Utah, so she needs scarves during the winter, and 2, she always appreciates the nature. They live right outside Zion National Park, and she is awesome, and I love her, and she'll appreciate the color changes. So, stash enhancement. So along with those 2 colors of the Lion Brand Amazing, which here are the other 2, yes, it is Aurora and Glacial Bay. These are the other 2 that match that. I also have 6 balls, I'm not bringing them all out, 6 balls of the Pink Sands, all in the same dye lot. So there's 6 balls at about 150 yards apiece, so it's about 800 yards of this yarn. What I'm thinking about doing is, because it is all in the same dye lot, I am planning on doing the clapouti out of it, and seeing how that goes. I think that the colors will do well with it, so we'll see. More yarn. I'm not going to undo this. This is all the same dye lot of Pink Fun Fur. All of it. Right now I see 10. Oh, no, there's 12. There are 12 balls of Fun Fur in this. All pink, all the same colorway. This, I know at least 2 balls will be for a scarf for my local, my church group has a women's guild that I'm a member of, and we do a Christmas party every year with a dirty Santa, white elephant, whatever you want to call it, Yankee swap type Christmas gift. Last year I made a fun fur scarf. I believe it was either red or white, going with the Christmas theme. There were literal fights over it, so I'm making another one this year. I'm also thinking about doing a scarf out of this for my, I guess she would be my aunt, kind of-ish. It's my mother's boyfriend's sister, and I just sort of call him my stepdad to make things easier, so I guess that would sort of be my aunt, for Christmas, because she'd love it. And she's also in the desert, so she can use, warm stuff in the winter. And it's a cute shade of pink. Can't really see it through the plastic, but I don't... She tied it really, really well. And it's actually in the bags from the store. But yeah. So, I have enough for like 6 different scarves. So we'll see what all happens with that. There's also more fun fur. This is Fun Fur Prints in the confetti colorway, and my camera has decided to stop focusing because it hates me. There are 3 or 4 balls of this. There is also, this is Patton's Upcountry in the Silver Mist colorway. Haha, there we go. I think I counted 3 or 4 in this same dye lot and colorway, and then there's 2 of the same yarn in the ice blue colorway. The gray I know is going to be the Gaptastic cowl pattern, which I think will be super cute. The blue, I think I had decided and I forgot what I decided it was going to be. And then the last bag is 1, 2, 3, 4, 5, 6, 7 balls of this Lion Brand Incredible, which is a ribbon yarn. No, I don't know what I'm going to do with it, but it is all the blue shades colorway, all the same dye lot. I know that it will probably be something for my mother. There's a pattern on the label for a cute little scarf. It's crocheted and it's 3 balls of this. My mother loves blues, so maybe next year's Christmas present? We'll see. So that is it from my yarn I did not have to pay for. The second bit is yarn that I mostly paid for. Okay, so last week I showed that my order from the Loopy U had gotten switched up. Thankfully I talked to Sherry on Monday and we fixed it up, got everything sorted out. She actually let me have the yarn that I ordered, that I got by mistake, that was someone else's order. It is Malabrigo Sock in the African Violet colorway. And it's, I think, 400 or 430 yards. 440 yards. I have no idea what this is going to be. Usually when I buy yarn, I have some semblance of an idea what it's going to be. This one, no clue. Because I technically didn't order it. So, I'm figuring out what this is going to be. And I don't know yet. I did, however, get the yarn that I did order. And I am so in love with this one. This is Malabrigo Rios in the Arco Iris colorway, which is rainbow. There's a lot more green and purple than the rest of the colors, but most of the other colors show up. There's some blues, some reds, some yellows. This is going to be the, I think it's called the Urban Necessity gloves. It's a set of Glittens, so fingerless gloves with the mitten flap that can come over. For myself, because as much as I love my Bella's mittens, I need to be able to access my phone. And they're a bit bulky when you're going into class, because sometimes the classes are still ridiculously cold, but you can't really write with the mittens on. So, these gloves. Would I like to get them done before Christmas? Yes. Will that happen? Probably not. Yeah. This may wind up being wrapped and put under the Christmas tree for me. I haven't decided, because I will still get excited if I open this on Christmas Day, because the colors are awesome. Come on. So yeah, I'm looking forward to doing those gloves, but quite frankly, there are much more pressing projects at this point. The second thing that I got in that order is the Shibui Knit sock in the Spectrum colorway. This, I have not entirely decided. I ordered it thinking that it would be preemie caps, and I think part of it will still be preemie caps. The other part may be a stethoscope cover, it may be more preemie caps, or it may be a set of fingerless mittens. I have not decided. I'm thinking the whole thing might be preemie caps, because these colors are kind of awesome. And it makes me happy. I don't know why it's coming out so yellow. A lot of the colors that I think are showing up as orange are actually red. But you get the point. It's pretty colors, so of course I love it. So that is it for stash enhancement, amazingly enough. My other knitting related things. I went to the library yesterday, and among other things, I picked up a couple knitting books. And I've actually read some of them because I didn't want to be doing my clinical paperwork, which I finally finished, and that's why I'm recording late, because I was working on them from Thursday afternoon until just now. Pretty much straight through. It's a lot of paperwork. I had 2 different patients this week, so yeah. The first one I will start with is not a full review, because after I read the introduction, I decided that I want this book for Christmas. It is Sock Innovation, and I was reading, I didn't really pay attention to the front cover or anything. I started reading the introduction to the book. I was talking about math and all the things from my undergraduate degree that I love and that my husband is so passionate about, and designing, and it has all the cute in there of how she gets to an idea that she likes. And I was like, dude, this is awesome. And then I looked at the author. I know it's backwards, but come on, you know who it is. It's Cookie A. So I've looked at some of the pictures. I have not looked at everything. I really want this book for Christmas. So I'm gonna wait to read it, because it's like a $20 book. On Amazon it's probably a lot less, and I know that my family members are always looking for actual, like, tangible gifts and not just gift cards. So yeah, this one's gonna wind up being under my Christmas tree, even if I have to buy it and put it under. The next one, which I actually read the entire thing, and I also kind of want to get a copy for myself, is Knitting for Good by Betsy Greer, which I thought was amusing because that's my sister-in-law's last name. Her husband's last name is Greer. But it talks a lot about knitting for yourself, knitting for your community, and knitting for the world. The two most interesting things that I found in here, it was talking about teaching others to knit, and it did the usual suspects, the teaching children, teaching old people. The next one was teaching prisoners, which is not something that a lot of us would think about, but actually kind of makes a lot of sense. Obviously you would want to watch who you're teaching because you don't want to teach like someone who's in for murder how to play with sharp pointy sticks, but it's definitely interesting. Something that I might look into. The other thing, I forget what the other thing was, but there's lots of patterns in here. Baby blankets, scarves, hats, different objects that you can donate, and I love it. I will probably get a copy of this book for myself. I do kind of wish that she had put in a pattern for the knitted globe on the front, because that's just cool. The other book that I got, and I don't think I read the title. This one, I think I just looked at the author and not the title of the book. It's Socks from the Toe Up by Wendy Johnson. And I ignored the fact that it's toe up. I can't bind off socks at the top to save my life. I really can't. They get all flared and weird, and I don't care if they're that way for me, but I care if they're that way for other people. So I don't know what I was thinking. But I didn't buy it, so it's okay. But there's loads of pretty patterns in the book, and you should definitely check them out. And of course, there's always ways to switch up the patterns and make them work for cuff down. This one, this is the lace socks. Obviously caught my eye because they almost look like the Twisty Goo socks I just did, or the Twisty Goo hat. And there's all the socks in here are super cute. I personally don't do lace socks because I would poke my toes through them and stretch out the socks weird. But they are very pretty. You could probably adapt the lace and use it in other patterns. I may wind up doing that. But that is it for strictly knitting. I'm trying to think of how far along this 11 Pipers Piping was the last time I showed it. I'll show it anyway, if I can get all of this stuff off of it. Okay. There we go. Alright. So this is the 11 Pipers Piping. He doesn't have any arms, and he doesn't have his trumpet. But he has a little banner that goes down that like unfurls from the trumpet, and I'm working on that right now. Right now I'm going to put in these outline that separates the 4 quadrants from each other, and then put in the sequins in the center and here on this curly Q, and then attach this. And I think the next one after that is the actual Piper. But it's gonna get done before we go home, and I'm so excited about that because if I didn't get that done this Christmas, I think my mother-in-law would kill me. I was going to try and have it done by last Christmas, but it didn't really happen. Oh, so that is it for knitting stuff. Nursing school. It was a good week. These next 2 weeks are probably not going to be. I have 3 tests on Monday and Tuesday. I have 2 tests on Monday and 1 on Tuesday. I have a part of my research project for one class due on Wednesday. I have a research paper for another on Friday. I have a poster session for the research project that I first mentioned the next Monday. I have my last day of clinical on that Wednesday, and then I have my physical assessment validation, and I have to have all of my lab hours in for open lab on Thursday. I guess technically it could be later than Thursday, but I always get assigned to the earliest time spot. It's either going to be Thursday, Friday, the next Monday, or Tuesday. And I'm hoping that it's one of the earlier time slots. Because I want to go to my knitting group that next Tuesday. The Tuesday before Thanksgiving. Because as long as I don't have to validate that day, I don't have any class in the afternoon. So I'm going to my knitting group. It is a whole lot of stuff. A whole lot of stuff. But it is entirely manageable, and after my physical assessment validation, I'm almost entirely done for the semester. I believe I've got 3 finals, I think a final simulation, and yeah, that's it. It's just tests and a simulation. And quite frankly, the simulations are nothing compared to what we have to go through for clinical, so not that worried. So I just have to make it through the next 2 weeks. I keep telling myself that. I just have to make the Thanksgiving, and then I'm fine. Completely 100% fine. Because I'm not going to have to revalidate, for the PA validation. You have to make above an 85%, and I know all of this stuff for the validation. I have to make sure that I can do it in less than 30 minutes, and that my documentation is okay. But I know all of this stuff, I know how to do it, and I can remember everything. I just have to make sure that I can do it in under 30 minutes. And that's what this week in lab is dedicated to. So, we'll see how that goes. This past week was actually a good week. We didn't have class on Monday, which was kind of awesome. Wound up going to school anyway to work on a project, but clinical was good. I had 2 different patients. It's the first week that I've had 2 different patients on the 2 days. Because my first patient was discharged at the very end of our shift. Nothing too... There's a hair on my computer, it won't come off. Nothing too spectacular with the first case. Just your general COPD, congestive heart failure, making sure that there's not an excess of fluid that the patient's getting. She had fluid restrictions, so making sure that she didn't get up and get herself some water, because we are trying to prevent fluid buildup, because her heart can't beat against the blood that's already in her system, so we don't want to add more fluid to it. But she was discharged. She looked a lot better than even when I first met her on Tuesday. So hopefully everything goes well. And my patient on Thursday. Thursday was hands down like one of the best days of my life. Seriously, so freaking cool. I met my patient for Thursday on Wednesday afternoon, right before we left. I think that all of my patients can pretty much be summed up by my instructor in one word: interesting. My instructor loves giving me difficult cases, interesting cases, cases where I'm going to learn a lot. And I very much appreciate that. Especially yesterday. Or Thursday. I don't remember what day it is anymore. So freaking cool. Note, my patient had a terminal illness, and I'm trying not to think about that because I'm just trying to focus on I got to see cool stuff and not really think about the fact that my patient only has a couple months to live. So this is not me making light of my patient's situation, but if I start fully thinking about that, I think I will start crying. So I met my patient who had been complaining of chest pain and finding it difficult to breathe. Turns out that he had a tumor the size of a softball in his lung. And that tumor was taking so much of his blood. Tumors are highly vascular a lot of the time because they need the excess blood and fluid and nutrients so that the cells can continue to divide in a way that they are not supposed to. It was dumping excess fluid into the pleural space, which in your lungs, you've got your lung and it's surrounded by a thin layer of tissue, and then there is dead space and another layer of tissue. When your lung expands, it fills up that space. When you exhale, it shrinks back up and there's the dead space again. It is supposed to be a vacuum. Sometimes it doesn't happen that way. That space was filling up with fluid from the tumor. I'm trying to think of a way to put this into perspective. So, think about a quart of milk. That's about a liter. My patient was draining 1.5 liters to 2 liters of fluid a day from that lung without any kind of suction. He had a chest tube in, and just freely from gravity, from the pressure building up in that lung, was draining 2 quarts of fluid a day. Yeah. It's a lot. Thursday morning. Okay, so Wednesday afternoon, I actually met the med student who was working with my patient because I was sitting next to him in the computer room, and he heard me use the phrase massive, massive tumor in the lung, and I knew that it was the same patient. So he told me that the next day they were planning on obliterating the pleural space, like completely getting rid of it. And so I was obviously interested in that, and so I had him explain the procedure to me. And the next morning, during our pre-conference, I explained the entire procedure to my instructor. And she said that if I got approval from surgery, I could go in and see it. So I got to go in and see surgery as a first semester nursing student. Oh my god. Literally, no one else in my class, the entire my program section, no one else has gone into surgery. Unless they were the patient. Yeah. I mean, I've gone into surgery as a patient, but it's a lot different, and it's so much more cool when you're not the patient. So I got to go in and I spent the entire morning from 6:30 to about noon down in pre-op, and I got to do the physical assessment, talk to anesthesia and figure out all of that fun stuff, go into the OR, scrub in, got to see the entire procedure. I literally got to see a tumor that was the size of a softball in someone's lung. And they had the endoscope, which is like the little tube that they can maneuver with the camera at the end. Haha. And I got to see on the screen, like, going into the lung. Yes, my geek is showing. I don't care. It was so freaking cool. So we went into surgery and they drained 3 liters of fluid in an hour. 3 liters of fluid. Which is insane. It was actually more than that. One of the, so when they have a chest tube, the tube drains down into a collection device. One of them was overflowing. So it was actually probably more like 3.5 liters of fluid that was drained. We got everything that we could out. Then they used talcum powder and applied it to the 2 layers of the pleura to stick them together so that the fluid couldn't build up there anymore. I mean, some of it would, but it's a lot harder. If you're thinking of a plastic bag, you have to sort of open it up first before you pour liquid into it, but if you leave it kind of together, the fluid doesn't have enough force to push the 2 layers apart. It's like that. They took biopsies from the 2 tumors and put in another chest tube. So my patient has 2 chest tubes to drain the fluid from his lung. It turns out that my patient had small cell carcinoma that had metastasized from his liver and is in his lymph nodes. So, he has a couple months, and it's not a great situation to be in, and he is by himself, so I have gone to visit him when I have free time, just because he doesn't have anyone else. Which I think is part of the reason that I was also assigned to him. As my instructor put it, I am able to deal with difficult emotional situations because I have learned to empathize but still distance myself from the situation, which you have to be able to do as a nurse, because if you feel everything that your patient feels and you can't separate yourself from that, you are going to burn out. I watched my father die from lung cancer when I was 15, and it'll be 7 years in March, and it was pretty much exactly the same when I was dealing with this patient. He actually looked a lot like my father, a lot younger than when my father had died. He was about the same age that my father was when he was first diagnosed. My father was first diagnosed with lung cancer shortly before I was born. He was diagnosed with 3 separate cancers, and it wasn't until the 3rd one, which was 17 years later, that he finally passed away. So there are chances that he could pull through, but with this level of metastasis, it's really not likely. And his not my dad's, but the patient's birthday is actually coming up. So I'm hoping to bring him something in the hospital if he is still there. I'm assuming that he will be because he just went under a major surgery. So hopefully he will not be leaving the hospital very soon. But afterwards, when my patient had come back from his surgery, I had come back from lunch, I was looking after my patient, doing vitals, making sure that everything was okay. And the charge nurse, who is very close friends with my professor, came in and they are both fans of the Socratic method of teaching, where you're asking a lot of questions and not really explaining, just letting the student get there on their own. Which sometimes I don't enjoy during the process, but it does teach me a lot more. But Rick, the charge nurse, started asking me bunches of questions, and I think that I was just on such a high after going through surgery that I just knew the answer to every single one. Just bam, 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 knew every single answer. And he left and had told me that he was very impressed with my knowledge. And then one of my classmates came into the room and told me that Rick was out in the hall talking to my professor and saying wonderful things about me to Dr. Hahn, which later in the day I went out to talk to her when we were getting ready to go, and she told me that whenever she said it's normal to hear patients say that they really appreciated what the nurse did for them. It's quite another to have another nurse compliment the nursing students on what they do. And as she put it, when another nurse compliments me on the work that my students do, it reflects well on my teaching, on you, on this program, and on the entire school. And so that makes me very proud of you. Which it means the world to me. It really does. Just it's the same thing where it's one thing if your friends and family tell you that you're going to make a great nurse. It's a lot different hearing it from someone who has been teaching for so long and has seen so many nursing students, to have them tell you that you are destined for great things and that you are excelling. It's very humbling and it's very exhilarating. I can't think of the right words. It's very encouraging to know that other nurses think that I am doing what I'm supposed to be doing, because every so often I have to be reminded of that. I'm gonna stop babbling because I'm at like 50 minutes. Oh dear lord. I did warn you at the beginning that it was gonna be a long episode. So that is about it. I have finally said everything and shown everything that I got. I swear to Jesus that I am not buying any more yarn. I wouldn't have anywhere to put it, among other things. I'm not buying any more yarn. Will would kill me. Literally kill me if I brought more yarn into this house, so I'm not going to. I am not responsible if someone sends it to me for Christmas or if it winds up under the tree, but I'm not bringing any more yarn into this house. So until next time, go Bama, Roll Tide, War Eagle, and go Blazers, and go any football team that you happen to be watching today, tomorrow, whenever. And I hope that y'all are getting cold weather like we're getting, because I love this weather. Seriously, it's awesome. Bye, guys.